There's a statistic that says that people with anorexia think about food 110% of the time. How's that possible? They dream about it as well. And they talk about it as like this static in your head that's just going all day, just like constant chatter of like calories of what I should eat, what I shouldn't eat.
What's this food gonna do to me when I eat it? But that doesn't define who you are. You are stronger than your eating disorder. It does take time to shut that feeling down, but it is so, so important.
Eating disorders have the highest mortality rate of all mental illness.
Food in our culture is everywhere. Making sure that we can have a comfortable relationship with food is really, really important.
Have you seen her lately? She's wasting away to nothing.
A lot of people think that the parents are responsible, but it's biological, it is environmental, it is coming from peer groups and social media.
They're trying to feel better, trying to numb, or trying to make themselves become an ideal that they have a vision of.
Eating disorders also give the child control because they're feeling so out of control in their home environments, and the one thing they absolutely can control is what they're putting into their bodies.
It makes sense. It comes on right after probably the onset of puberty. So you have a lot of social pressures, peer pressure. People are kind of getting used to their new body, and they may not like how they feel or look.
I'll never be good enough.
Potential warning signs like weight loss, focus on body image, counting calories, using the bathroom after meal times, over-exercising, overeating to the point of causing illness.
They're very food focused. They'll talk about food. They'll talk about calories. They'll watch you cook.
If your kid is constantly looking in the mirror, or if they're looking at lots of magazines, specifically cutting things out.
It may not be indicative of an eating disorder, but it may. Those who seek treatment early on have the best chance at full recovery.
I'm such a failure.
It's important to separate the child from the illness. It takes a lot of burden off of the parents because they can feel incredibly guilty.
Your child doesn't want to be sick. They don't want to feel this way. And they are feeling just as helpless as you.
It's complex in that it's both a psychological, illness, but with so much medical components with it that sometimes the medical stuff is the eminent, most important feature, and we need to address that right now. We'll deal with the other stuff later.
Here at Acadia Hospital, we can evaluate, one, if there's an eating disorder that's occurring, and two, what we need to do about it.
We need to refeed, renourish that brain, get some cognitive function back and working before you're really going to see any benefits from the psychiatric medications or from the therapy.
No one will ever love me.
You need to be able to have that open communication and let your child know that they have a safe space with you and that you are going to support them.
Parents are not going to cause an eating disorder by asking about it. And so ask questions, pay attention. If your child is reporting, I'm really worried about my weight, reach out for help.
You don't realize how much your eating disorder is controlling your life until your parents are affected by it, and seeing how much they were affected by it really made me want to better myself. And having them with me was overwhelmingly amazing.
What you're fighting is not your child, but the eating disorder itself. So you have to be diligent on watching your child, what they're eating, encouraging them to eat, having family meals together.
It's hard. I'm working on it every single day. It takes time. You have to be patient with yourself, but there is hope from admitting that there's a problem. You can conquer it.